Hello everyone, my name is Derek Lynch and today I'll be presenting on social distancing in the age of COVID-19. So according to the Center for Disease Control and Prevention, there are currently 44,183 cases of coronavirus in the United States. And that number extends to roughly 500,000 worldwide as of today. I'm sure you've all heard of the coronavirus COVID-19, and I'm sure you've heard of social distancing as well. Social distancing is a necessary and simple process that we can all follow in order to maintain public health and keep everyone around us safe and healthy. So today when I talk about social distancing, I'm going to talk about what it is, how we can practice it, and why it is necessary. So first, what is social distancing? The Public Health Department of Santa Clara Valley Health and Hospital System refers to social distancing as a term applied to certain actions that are taken by public health officials to stop or slow down the spread of a highly contagious disease. Now, I'd like to expand that definition not just to public health officials, but to all of us as individuals. Social distancing is something that we all practice. In addition, I want to clarify that social distancing is not the same as quarantining. Social distancing is a set of procedures and processes that we can all follow in order to stop a disease from spreading, wherein quarantine involves an individual separating themselves from the collective group, either in order to protect their own health or to make sure that their health doesn't impact others. This is not the first time that social distancing has been practiced en masse. According to the Center for Evidence-Based Medicine, first in 1916 during the New York City polio epidemic, and then in 1918 during the influenza epidemic, social distancing was recommended by experts as a way to mitigate the spread of those diseases. So now that we know what social distancing is, I want to talk about how to practice it. By now, we've all begun to practice the community-based aspects of social distancing. A lot of our jobs have closed down, our schools are online, our community spaces like restaurants, movie theaters, laundromats, and other public entities have all largely shut down. And that's part of social distancing, right? That's the community-based aspect of social distancing. So according to WBUR, as of March 23rd, Governor Baker had issued a statement in which he closed all non-essential businesses across the Commonwealth. And really what that means is that the only businesses currently open are grocery stores, pharmacies, and largely healthcare settings. In addition, Governor Baker recommended that gatherings of any larger than 10 people are highly discouraged. And it's not just Governor Baker that's issuing these states of emergency. Most states across the country, and according to US Today, as of March 21st, the federal government have also mandated a state of emergency. So while those are the community-based steps that we're taking to practice social distancing, personal steps are just as important. And a few personal steps in order to follow social distancing are washing your hands, making sure to wash for 20 seconds with warm water and soap. In addition, staying 6 feet away from other people as much as is possible, disinfecting spaces around you, whether it's your phone or door handles or anything that you might touch several times a day, as well as staying at home and restricting your travel to only essential trips. So that's how we practice social distancing, and now I'd like to talk about why social distancing has been viewed as necessary. First, it protects the vulnerable. There are a lot of people whose immune systems are compromised, and they're more susceptible to the spreading of a highly contagious disease such as COVID-19. This involves many people in the high-risk population, whether it be the elderly, people with life-threatening or chronic medical conditions, any number of vulnerable populations in which their immune systems might not be equipped to fight off COVID-19 as well as an able-bodied person their immune system would be. And so as a result, even those of us that are considered low risk are at high risk of spreading COVID-19 to people who are susceptible to receiving the illness. And that's why social distancing is key, because we could unknowingly pass, the disease to someone else. Likewise, there's proof that social distancing is already working in mitigating the spread of the coronavirus. The New York Times reported on March 25th that in New York City, there's already been proof that the numbers are going to begin to drop because of the stringent measures that have been issued in order to keep people distanced from one another. And in addition, cases in China have begun to drop, largely in part to social distancing. So ultimately, social distancing is simple, it's necessary, and it saves lives. In conclusion, today we talked about social distancing really as three parts. We talked about what it is, we talked about how to practice social distancing, and why experts view it as necessary. Ultimately, the CDC has announced that there are 44,183 cases in the United States of COVID-19, and by the time I gave this speech, that number has probably risen. Social distancing is viewed as all medical experts as the most effective way of mitigating the spread of this virus, and it's something that is very important for each of us to know. Thank you, and have a great day.